for your comments. I agree with you that the problem of access and organisation of health and social services for vulnerable children at risk, is a very important point. But there's one point that hasn't been mentioned. Nobody's underlined the importance, I think, of having an influence on our political actors so that they can undertake actions to actually reduce poverty and reduce the number of poor children or disadvantaged children. Do you think it's possible? That's one question. And secondly, would that not actually reduce the requests for services to be provided so that we can really tackle things at the root? I cannot believe that all of these poor families who are not able to carry out their parental tasks, and if we could remove this stress of poverty, that would make a big difference and get them out of this impoverished situation. I think that's the most important point, and I haven't heard anything about that, so I'd like to get your feedback on this question of poverty reduction. Nico, Madam, you are completely right. Perhaps it's because of the in which we started to tackle this question when we were talking about the access to services that meant that we didn't touch on this, but you're quite right. The top priority has to be to actually tackle this question of poverty and housing, which means that these children remain in a particularly vulnerable situation. That's the best investment that we could make, is to get them out of poverty. Gilles, well, perhaps going to take a slightly different angle. We're living in a capitalist world. In all capitalist countries throughout history, poverty has existed. Yes, of course, it's a major issue to reduce poverty, but if we just focus on that, then we know that it's not going to happen. It's never happened down through history, so I don't see why it would actually happen today. We're not a better society today. We shouldn't put on our rosa-tinted glasses. We're not a better society. We've just evolved a bit further. That's crystal clear for me in my mind. And we've decided to not talk too much about poverty. And this dates back quite some time. I was a consultant for the Community Party. And we were working on this poverty reduction objective in 2000. And this was back in 1990 that we started developing this. And everyone was very serious. We wanted to eradicate poverty by the year 2000. But I've stopped believing in that. I'd expressed my opinion, said, I think we put on rose-tinted glasses here. And in fact, things are worse. We're far from having eradicated poverty, in fact. So if we want to tackle that, it's going to take a great deal of time. I know the consequences of poverty. That's what I say in my daily practice. And I find this a total injustice. We decided to deal instead with social fairness, the sharing of wealth, and equip all the children equally. And why did we decide to do this? It was because of the International Convention on the Rights of Children to be equal and to be in good health, and the 41 rights listed in that convention. It's much easier to turn to a politician and say we want to talk about social equality rather than going to a politician saying we don't want to have any poor people anymore. He'll just freak out and he'll just run away from politics, if you say that to him. That's why we agree with this principle, but we have to take it from a different angle in terms of social equality and give tools, and we want to equip our children so that they can develop further and not reproduce this situation of poverty. We want to invest in the children rather than talking about massive investments that we don't have. If we're a capitalist society, we have to forget this dream of reducing poverty. But we've seen that non-capitalist countries such as communist countries, and I lived through that in Albania, it's even poorer than if you were in a communist country. So let's try and sort that one out. Well, we've launched a debate that could become an endless one. But we have to realize that there are variations on this theme from one country to another and from one province to another. In Quebec, we invest more in the question of poverty compared to the rest of Canada, and in general, we do have positive results. So it is important to nuance that. We have to continue to defend this approach, which underlines the importance, amongst other things, of eradicating poverty. But this is a pipe dream. We're not going to achieve that. But there is a significant investment being made in this direction in Quebec, and I want to ensure that we don't actually lose that investment. It's not a completely capitalist world. There are choices that have to meet. I think we've made the right choices, and we should not forget the fact that our children here in Quebec have better results than the majority of children in North America. And that's in part because of this investment that we've made, this conscious investment. Just a closing point on this, and then I'll take two other questions, and then we'll go off for lunch. Nick, first of all. We really need to follow the example set by other countries where they don't have wall-to-wall politics that are completely the same, but interventions in schools or in social issues are specifically focused on the individual needs of the children. It's not in schools, it's not about a teaching plan for class 1, 2 or 3, but rather it's an individualized teaching plan for each child. For example, in Finland, what is the percentage of school dropouts in Finland for the country as a whole? 10 children. 10 children in Finland, not in terms of percentages. So we can do this, and it is already being done elsewhere. Thank you very much, Nick. Madam, yes. Good afternoon. I've got more of a comment, in fact, if I can. When we discussed the actions that we're undertaking, whether we did these based on habit or based on scientific data, you seem to be more in favour of scientific data and a scientific data-based approach. What's good for a population might not be so good for an individual, so I have some questions about this. And I think this removes a great deal of value from the clinical experience of people. Scientific data has many limits when it comes to applying it to individuals. That's just a little nuance there. Who would like to respond? Perhaps Dr. Julien? Yes, I agree with you. Scientific data are there to influence politics and politicians in a global approach, not, of course, at an individual-based level. When we looked at scientific data this morning, all of the evidence, scientific data guides us towards a more human-based intervention system, getting closer to people. And that's extraordinary, because we know intuitively that this is the case when we sit down with people and when we accompany them. It makes a real difference. And this morning the scientists have told us the same thing. The researchers and scientific data have shown this. They've just told us, have a more human-based approach. We can't solve problems suffering, but if you're next to them, they'll suffer a bit less. So I just wanted to underline the contributions that we've heard this morning. When you work like that, you're on the right path. But scientific data and research data are very important in terms of influencing health policies. If research data and scientific data say, it's not always the case, but if they say you're investing $100 million in a program, and if you're told your program's useless, but if the data are showing that it's useless, then there's not going to be any outcome. For example, in cardiology, this happened, then a politician can say yes or no. And the more scientific data you give them, the more influence you can have. But once a politician likes a program, we're toast that they're going to drive forward with it, even if it is useless.